A homelessness system overview. We talked a little bit about the different funding sources and the component types or program types. Today, we're focusing on intake assessment and housing plans. Then in 2 weeks, we'll focus on client-centered practices, specifically on trauma responsive care. The trauma will come up today, but really focusing on that in our training on June 9th. That one's followed on June 23rd. It's housing focused practices. We're trying to make an effort to shift our language a bit. In the past, we've used the term housing first, but we're shifting, and it's essentially some of the same concepts, the core principles, but we're framing it as housing focused practices. So just know that if you're expecting housing first, you'll likely hear some of that content in what we're calling the 104 training on the 23rd. Then, as we've done trainings in the past, and this certainly comes up in the work that you all are engaged in, really challenging clients and participants who either are struggling to engage or just simply don't appear to be engaged. It's a common issue, so we'll spend that training talking about meaningful engagement for hard to serve clients. And the focus on that one is motivational interviewing and some of the strategies and techniques for engaging people when then they're not likely to engage just on their own volition. Then we're going to meet in person. We'll finally have an opportunity to engage in a real life setting on July 21st, and that's an in-person workshop, a large chunk of time. We're going to be applying all of these concepts. So we'll add both additional content and sort of tricks and tips on applying some of the core concepts. We'll bring some specific tools, intake protocols, forms, schedules that we can distribute, and that we'll also have an opportunity to actually do some kind of in-person practice. So we're looking forward to that opportunity for that workshop. So if we go to the next slide, it's our agenda for today. Obviously, I introduced myself. Liz will jump in just a moment.
There we go, Seneca.
And yeah, thanks. We'll be focusing on case management guidelines, and I'll start with some of the values that inform our work, the vision for what we hope to accomplish, and then some measurable goals or how we track the impact of our intake and assessment process. We'll then talk about the beginning stages of intake and assessment related to engaging people, either people who are literally homeless right now or at risk of homelessness. And we'll talk about some techniques and strategies for engagement. Then the actual intake and assessment process. This is going to look a little bit different depending on the particular role of a case manager, whether you're in outreach or maybe you're doing prevention, or if you're operating a shelter or transitional housing project. You all are doing intake and assessment. It just looks a little bit different. But we'll talk about some of the standard roles or the standard functions within intake and assessment. And then we'll start to focus on motivation, creating assessment, and then goal setting, all in that intake and assessment kind of setting. Accessing and stabilization in housing as a primary goal that everyone is working on, regardless of the particular case management function that you're playing. Everyone's working towards housing stability. So we'll talk about some of the strategies, again, related to ongoing assessment and gauging participants' progress towards stability and long-term housing success. And especially during times when people are moving into housing for the first time from a crisis setting, either from a shelter setting or maybe even from an unsheltered setting, those first couple weeks or months during that housing move-in is a particularly challenging transition period. So we'll end our discussion today talking about some of the transition supports to manage that transition, ensure that participants have the resources they need, the connection to community benefits and resources to help stabilize them in housing. So I'm going to jump right in and shift to case management roles. I want to acknowledge that some of you are coming to this training from different component types. So some of you might be an outreach person who's doing sort of roving or remote engagement work for people who are unsheltered. And that's the role of case management is a little bit different. Your goal is focused on helping people who are unsheltered and maybe in crisis, but connecting them to housing or connecting them to a crisis response. So you're focused on building trust, addressing some safety, and linking people to resources that they might not be engaged with currently. So that's going to be a little bit different if you're a case manager in a street outreach setting. If you're working in diversion or prevention, maybe that initial contact has already been made, and we're now focused on helping to avoid longer periods of instability or avoid shelter, in fact, altogether. So the focus of your work is, again, intake and assessment, but identifying resources or supports that that household can leverage so that they can quickly resolve their housing crisis. If you're a case manager in an emergency shelter setting, the focus might be to quickly engage and then help transition folks out of shelter, out of that crisis setting, into some other either intermediate term housing or even permanent housing that's going to offer the stabilization and supports that they need. So your focus is on addressing the barriers that might inhibit their ability to move into housing. Sometimes it's on just collecting documentation, verifying eligibility, getting all of that sort of administrative pieces in place to support someone in the next step of the housing. And the next step could be transitional housing. Some of you might be case managers in a transitional housing setting. So you're focused maybe on more intensive services to address a particular issue, housing barrier, and that intensive service focus is your primary case management role. But that's going to be a little bit different if the focus is as a case manager in a rapid rehousing or a permanent supportive housing setting. In both of those settings, your primary goal is to either obtain or maintain, sustain housing placement over time, or help with a transition if people are after they're leaving rapid housing going to a different housing setting. But the focus is long-term housing stability, preventing the loss of housing, preventing evictions. So in all of these case management roles, the focus, the goal is going to be slightly different, but the strategies and the techniques that you will use to support intake, engagement, and assessment are going to have some similarities across all of these roles. So just want to acknowledge that you come at this from different places, but there are some commonalities, and we'll try and flesh those out in today's training. So I just wanted to engage you all and find out in our Zoom poll how long you've been in your current position. Is it relatively new? What's the length of tenure that you've had? And then how much experience do you have in case management work in general? So take a couple of minutes and answer that first question. How long have you been in your current position? And you'll just choose one. It can be less than a month, 1 to 3 months, up to 6 months, up to a year, or more than a year. And then after you've answered that question, kind of scroll down and look at that second question and go ahead and answer that one as well. How much experience do you have in case management work altogether? So if you've had multiple positions over time, what's your total experience in case management collectively across all the positions? It looks like people are completing that assessment. I'm just going to give you a couple more minutes. All right, so you should be able to see if we share those results. Most of you, the majority, have been in your current position for more than a year. That's great. But some of you have only been in the current position for less than a year. So that looks like there's some distribution of, in the first year of your job, or maybe about half in the second year or longer. And then all told, we've got a couple of seasoned veterans in the field who've been doing this for longer than they can remember or more than 5 years. And then another cohort, about 50% of you, less than 3 years. So just want to acknowledge there are, as always, even if you've been doing this for, 5, 6, 7, even close to 10 years, always opportunities to learn from others about strategies and techniques for refining our case management skills, checking in on what are evidence-based and best practices, and trying to kind of hone those skills or develop those skills, refine those skills So there's always for us to be improving our case management capacity as we work with clients to resolve their housing crisis. So thanks for sharing those updates. All right, we'll go on to case management values. Case management values inform why we come to this work and what we hope to accomplish. The primary case management value, obviously, is housing stability. Everyone is capable of resolving their crisis. It's going to look a little bit different, and the strategies and techniques we use to help people are going to be a little bit different. But what we all bring to this in our initial work is the value of resolving the crisis and bringing stability to every single person. There's also a sense of urgency. Homelessness itself and experiencing homelessness exacerbates or contributes to trauma. So, to the extent that we can end someone's homelessness or quickly put them on a pathway to housing resolution, it's going to decrease the amount of time that they're homeless. So, we all have a sense of urgency of moving as quickly as possible to resolve that housing crisis. We also want to respect where each client is coming from. They might be motivated by different interests, they're making different choices. What they need and what they want might be different from what you would choose for yourself, but that's okay. If we can respect the differences and elevate a client's sense of their own interests and their goals, it's going to build their agency and support their housing stability long term. Another value that we bring to this is relationship oriented. We can't just give someone a spreadsheet and say, follow these steps and you'll resolve your housing crisis. It's built on a relationship that's based in trust and direct and honesty and transparency. And that relationship is what is going to help the client or the person that you're working with access housing options and then maintain stability for the long term. Everyone's journey out of crisis is going to look a little bit different, and we are allies in helping them to navigate that journey. The pathway is going to be a little bit different, but to the extent that we can be a support, an ally in helping them wherever they are in their journey, that's going to be a value that we bring to this work. We want to minimize the risk and reduce harm both to our clients, but also to ourselves. And there's always an opportunity to kind of see what is sort of triggering or what is exacerbating someone's housing crisis and reduce that risk or reduce that harm as much as possible. And also to just check in amongst ourselves. This work can be really tough. We're dealing with really, in some cases, horrible circumstances of people at the worst point of their life, and continually working with that same kind of set of clients over time can really wear on our own sense of well-being. So I just want to acknowledge minimize risk and reduce harm speaks to a value both for our clients, but also for ourselves. And then also in terms of values, creating equal access and being consistent, that there's not preferences or differences in the way that people should have access to the resources that they need. We want to make those accessible and available to everyone. Continuing on, the next step of case management values, acknowledging that everyone is both ready for housing and capable of maintaining housing. They might need a different level of intensity of services. The pathway might be a little bit different. We certainly want to prevent returns to homelessness, but everyone is capable of maintaining housing. It might be, some people with really challenging acute needs are going to best be positioned to maintain housing in permanent supportive housing, where others that's not an option for them. So we have to look at what options are available and then use the community resources and our case management techniques to build the strength of that housing setting and support long-term stability. We are an interdependent group of providers. It's not likely that as a single case manager, you're going to be able to do this all on your own. So we also value that your supervisor, your peers within case management, community partners, other services throughout the community are going to be vital to helping you do your job as a case manager. We don't have the expectation that you're doing this alone or that you should do this alone. So we want to recognize that kind of interdependency, that network of supports from our provider community to support your caseload, to make sure that everyone has the resources and supports they need. We practice and support a culture of self-care. When you're feeling overwhelmed as a case manager, as I said, this can be a pretty tough job. When to say, hey, I need to tap out. I need to step away. I need, a 15-minute breather. Maybe there's a particularly challenging case or someone shares something that kind of triggers some kind of trauma for yourself, a past issue or challenge that you had to manage. So knowing when to ask for help, when to step away, and how to use the support system both from your supervisor and your peers is really critical. We'll talk more about that in subsequent trainings in dealing with trauma, but recognizing that that's a value, a case management value that we want to support. We're also flexible and creative problem solvers. There is no one size fits all. What will be a particularly good strategy for one client may not work for someone else. So we have to constantly be nimble and creative and thinking differently about what's the pathway for this particular client or this individual, and shifting our focus or being able to accommodate kind of different pathways, different roads to housing stability, so that everyone has access to the resources that they need. Finally, committing to data, accuracy, completeness, and timeliness. We use data to both document what we've done, what the needs are, what the pathway is, and that data helps build a case for the success and shows the amazing work that you all are doing. It also helps at a system level to describe the extent of homelessness and the needs of people experiencing a housing crisis so that we can continue to advocate for additional resources. We can build better interconnected systems. And those are all based on data and documentation. So not just getting an individual client eligible for a housing resource, but thinking about both that, which is highly critical, and building a stronger picture of how our system is functioning so that we continue to work towards refinement and improvement. And that's another value that we have. When we start with those values, then we transition to sort of a vision and a goals. Our vision is what we want to achieve at the end of the day, and goals are measurable steps or measurable activities that we can track that help us see whether or not we're achieving our vision. The vision here is to support people experiencing homelessness or at risk of homelessness, and we want them to achieve housing stability, to end their crisis. So the goals are identifying people at risk, connecting them to safe, appropriate housing resources, or maybe the supports they need to maintain their housing. That might be income or benefits, minimizing gaps or duplication, using the resources strategically and thoughtfully, directing resources in the most impactful way so that we can prevent or divert people when possible or end homelessness rapidly when we can't prevent it. Supporting people to meet the obligations of a lease. The lease is an important document if they're able to sign a lease and they're a tenant. We use the structure of that lease and their tenancy obligations to design our case management strategy. So those two are inextricably linked. And then when we're ready to move on, or the client's ready to move on to the next phase, whether you're a shelter worker and you're transitioning the client to a rapid rehousing setting or some other case management setting, thinking about what that handoff looks like. In the best of worlds, we're going to do that in a warm handoff, kind of in a person-to-person way, and then ensuring that there's some plan for aftercare, or if they need to come back or get additional supports from you, what the strategy is for follow-on care or for aftercare. So those vision and goals inform the work that we do. Now let's talk about the process, what these look like on a sort of a day-to-day basis. So the case management process has what we refer to as the engagement phase at the very beginning when we're first meeting the client for the first time or they've been referred to us. And that engagement is a critical time where we're building a relationship. We're starting to understand who this client is, what motivates them, what their history or their needs are, and we're starting to build a picture of what is likely going to be the strategy or the resources we need to help them resolve their crisis. And that's the intake and assessment process. After we've collected enough information or we have a stronger sense about what's motivating them and what their history is, we can develop a goal plan. That goal plan always has housing as an initial focus and the process of navigating to that housing. So we'll want to break those down into sort of digestible chunks that are feasible and help to build in a resource plan or a support plan so that the client knows what they're going to get to help them achieve that housing plan. Part of achieving that housing plan is building motivation. And what we perceive as a lack of motivation or a lack of follow through, just a lack of doing what we would understand to be the sort of basics or the required elements. It can be understood differently if we break down what the experience of homelessness actually is, which is often exacerbating trauma or creating trauma. So we need to think differently about building motivation in a trauma-informed or a trauma-responsive way. And then the next phase of our case management approach is building stabilization support. So once we have that sort of the assessment information and we've built a housing plan, we have some strategies in place to address motivational issues and engage them in as an agent in their own housing plan. What are the long-term kind of stabilization supports that they're going to need to maintain that housing? And so that is the sort of the one of the last phases of case management. And then at each of these phases, and as we said at the beginning of the training, some of you are outreach, some might be shelter workers, some might be rapid rehousing or transitional housing. And for many of the clients, there's going to be multiple transitions. So another process of case management is managing those transitions or those handoffs from one component or one staff person to the next. So that's kind of a sort of a pretty high overview of the case management process. What I want to do now is to have an opportunity for you all to interact. So what we're going to do is,
Can I interrupt just really quickly because we have
sure.
a hand? Kimberly has her hand
Oh,
up, so
great.
let's get
Yeah.
a question in there.
I now I just have one question. So sometimes, well, I work for a shelter, and sometimes when the clients are ready to leave, they got their housing. It's very hard for them to transition and leave the shelter. It's very, very emotional for them. And would there be anything that you would say or do to try to make it comfortable for them?
It's a great question, and I think it's actually a question that we might want to. And I think I stepped on Liz's slide a little bit, so
Oh, that's okay. No worries.
we'll get to a breakout. But I would be curious to understand what is the sort of the contributing or the source of their reticence. Why does it feel to that client that they might be expressing, I'm not ready to move. I just need a little bit more time in shelter, or I just need to kind of collect myself, or I'm not, and trying to sort of peel back the layers of what's the source of that lack of engagement, that lack of motivation, or just like fear about moving on to the next step. And it's going to be different for everyone. That might be their feel of failure. It might be that they're really just kind of immersed in their own experience of trauma, and they're not sort of at a point where they can engage. I mean, we have to think differently about how to connect a housing plan when people are at that, when they just aren't exhibiting strong motivation. That might be an interesting question for us to kind of chew on. So Liz, why don't we, I'm thinking we might want to actually even think about that in a small group discussion. And we had a couple of questions that we had identified, but this is probably a useful prompt. And so I would, if others have had similar circumstances where there's a client either in a shelter or an outreach setting, and they're reluctant to move on, reluctant to engage, what are some strategies that you might use to do this? So we're going to break into two groups. And first of all, I think we can just describe, what role you're playing, what agency you're with, but then maybe start to kind of drill down on have any of you had similar experiences with clients that just are not exhibiting motivation or not wanting to move on? And what strategies have you all used to engage them and connect them to a housing plan? We have, I think we scheduled maybe 8 minutes. So we're going to break into these two small groups. Liz will take one group and I'll take another. And we'll just have an opportunity for all of you to engage and meet one another and talk a little bit about the role that you're playing, and then maybe what strategies you have to engage someone who's not motivated. Folks are filtering back in. We had um, lots of ideas that came up in our group. I'll just share a couple and ask Liz if there's some that you
Yep,
want to share.
sure.
Food, we learned, is a primary motivator. So people, and it also can be kind of a way into building trust and a relationship. So just giving people something to eat and some water, addressing their basic needs, and that came up with a couple of folks. Any ideas in your group, Liz?
Well, Matt, we did talk about donuts. So our group was specific to the donuts, but
Okay.
yes, the importance of food, and just creating new communities for folks. So if you're leaving a shelter and that's a community that's really hard for you to leave, we're talking about, making it hard to go to, that it is difficult to move on to housing. How can we create new communities, new groups for folks there? And always having creative solutions and motivating folks and helping them see how great housing can be for them. So, yeah, great conversation.
Great. All right. Well, let's jump back into our slides. We'll talk about that very first contact. Whether you're a shelter worker, outreach worker, you're a rapid rehousing case manager, that very first contact is really critical because it kind of sets the stage for the intake. And as we mentioned as Liz and I, and then in our group also mentioned, food is a basic need, and that can be a way in. But that also just being seen and understood and social connections are a basic human need as well, just as much as food and water and shelter. And so just, saying, hi, I see you. What's going on with you today? How can I help? It gives people space to begin to engage. I also want to recognize that safety is always a way into deeper conversations about what the client is experiencing and what they need. So you might want to start with safety. That can be a good strategy. I've also asked just what do you need right now? So you might want to start with that. The focus is on immediate needs, and then that can evolve into housing. But you don't have to lead with housing right out of the gate. This is especially the case with outreach and sometimes shelter case managers. If you're working on rapid rehousing or PSH, the focus might start with getting to know the client and then linking their interests and their needs or their goals to housing stability. An intake appointment might be just an administrative activity for us, but for the client, it can feel like they're being judged or rejected. This is an interaction that is an opportunity for them to understand what this process is going to look like and how they're going to contribute to their own pathway. So we want to use that as an opportunity to help them to understand what they're looking for and how we can help them. The next focus that I want to address is trauma, and it comes up in very specific and sometimes unknown ways throughout someone's engagement and in their pathway to housing. Trauma is an emotional and physical response to what is a deeply distressing or life-threatening event that can shatter your sense of safety. The life event can be different for different people. It can be violence, it can be emotional abuse, it can be neglect, or it can simply be just poverty itself. The day-to-day work of getting by when you're so poor itself exacerbates or it creates or exacerbates trauma. When you're experiencing trauma, it can overload your nervous system, so it leaves you with sometimes lasting effects on your mental, physical, and emotional well-being. And trauma frequently alters how your brain functions. So it impacts your executive functioning, your decision making, and your ability to participate in what appears from outside, from our perspective, as just basic, logical, kind of sequential steps in addressing what is the next step in your housing plan. But for someone in the midst of trauma, it can arrest their ability to actually make concrete decisions or to move forward in what appears to us to be an appropriate or positive way. So just know that the manifestations of trauma, it can be different. Sometimes it's intrusive thoughts, sometimes it's flashbacks, it can be kind of a hypervigilance to maintain control, it can be avoidance, it might be negative mood shifts, it can be impulsive behavior. All of those are examples of how trauma is going to manifest itself, and we need to be aware of that in our intake and engagement process. So how this plays out with homelessness is helpful for us to understand. People experiencing homelessness are likely to have experienced a trauma in the past and then continue to exacerbate or complicate their trauma response into the future. So what we clearly now understand is kind of an interconnectedness between trauma and homelessness. Some people are going to experience housing instability and even homelessness stemming from a traumatic event in the future. So some family violence, emotional abuse, or a medical emergency or a loss of a job. But what we know from research is that the first time homeless is very often caused by a one-time traumatic event. And what we need to do is focus on building a sense of safety, creating kind of a sense of agency or self ability of the person to manage their own conditions and what's going to happen to them next, and beginning to work on some kind of self-regulation and relationship skills. It's important to keep trauma's effect in mind when you're working with clients and do things to help them feel safe. So it's important to maybe work on emphasizing safety, something that's predictable for them, emphasizing that they have choice. There might be three or four things that they can do, but they can at least choose which one they're going to focus on first. All of these activities are rebuilding a sense of control, but also being aware that there may be some activities or some interactions that might trigger re-traumatization, and to the greatest extent possible, we want to avoid that. Sometimes it might actually be asking them what exacerbates their feeling of isolation or frustration or anxiety, and knowing, is it like too many things at once? Is it having to manage their child or childcare and having to go into a case management meeting? And so if we can find childcare, that might help. Helping to engage them in addressing the strategies to address their trauma is actually itself building a sense of strength and agency and can help them move on. We want to follow trauma-informed or trauma-responsive care principles. And these principles are emphasizing safety, as we see on the slide, so that make sure that they're in a safe place, that they're in a place where they can work and work on their safety plan. Emphasize choice, that they have agency and a sense of control, and we can help them with the triggers that are maybe exacerbating or helping them or making them feel out of control. And then finally, emphasizing the client's strengths and their sense that they showed up today. They sought help, or they're in the process of getting help. They're working on a plan. All of these are kind of very positive activities, and we want to build on these core strengths, and that you're a support in helping them achieve these long-term stability goals, and that you're a trusting relationship that will be there for them as they manage their trauma and address their homelessness. So I think Liz is going to walk through some of these strategies in more detail now for us.
Thanks, Matt. So we're going to talk about building the relationship with folks. So even in the face of severe trauma, we know that the best strategy for successful engagement is to build a trusting relationship with your participant or your client. And Matt mentioned this a bit too. Remember that, and you know this, so you know this, but that the folks that you're working with could be super vulnerable. They may have real issues with trust. They may not be able to establish secure bonds. They may be people pleasers and they may not put their own needs first. They may have coping strategies that are putting them in a rough spot. They may be using substances or displaying risky behavior. They may self-isolate to numb the pain. So we know, and Matt mentioned this too, this is hard work, and you're dealing with people, like Matt said, maybe at the worst time in their life and the hardest time in their life. So this isn't easy stuff. So as we're talking about these strategies, we're really mindful that it's hard. But I do think these are great strategies. So be yourself, which is great. So folks are going to know if you're not being authentic. And I think even to share, hey, Bob, I had a terrible night's sleep tonight and my head hurts. So I'm listening to you and I'm gonna do the best I can, but this is where I am today. And remember, when we talk about working with tenants, we're also working on modeling really healthy and good behavior. So if you're authentic, what you're doing is giving your folks permission to also be authentic. We want to always show up, and we always want to be prompt and be on time and do what we said we're going to do. A lot of these folks have had to deal with systems failing them. A lot of people haven't shown up for them. A lot of services haven't really helped them out. And so it's really important, again, displaying behavior that we want them to show is to just be the good person that you are, right? Show up and be prompt, be on time. Listen to what the person really wants and cares about. So you may go in and think, woof, we got to get to DSS and then we got to fill out some housing applications, and you know you can do it and you know that would be great. But what's happening with your participant? Their foot really hurts. They have a terrible foot infection. And you know what? That's what they're going to care about. That's what they want to work on. So we may need to stop and work on basics, right? We need to get that foot taken care of. We need to let them know, well, I'm not a doctor, but let's find you a doctor and let's take care of your foot. It goes along too with, again, being patient, right? You want to go to DSS, you want to fill out all those applications, and you're good at it, and you know you can get a whole bunch of them done. But you know what? Bob just wants his foot taken care of, and he doesn't really want to fill out any housing applications today. And you know what? He really doesn't want to answer all your questions today because his foot really, really hurts. So you just don't want to push your own agenda, and maybe you'll get there. And when Bob's foot gets fixed, maybe we're going to keep moving on with other goals. So you're going to work on something together. You're going to start with something small and keep it simple. So again, Bob doesn't want to answer a million questions. Bob doesn't want to talk about his hopes and dreams right now and describe his best housing situation, but we might be able to have a goal of getting Bob to the doctor, and then maybe we can build on that goal. Matt talked about this too. We really have to make sure basics are taken care of. So we always want to make sure that either we're able to provide food, clothing, gear, hygiene and disease prevention supplies, documents, or again, you can't do everything. You know where to find all of these things. So you have all of these resources with you. And I love Andrea White on our team always talks about when we're helping folks with documents, you want to make sure everyone has a waterproof folder because things just happen to documents. And I always laugh too. The more important the document is for me, the bigger coffee stain I have on it. So we want a waterproof folder so people can put all their documents together and keep them safe and sound. And we want to present housing as a way to get wants, needs, and your goals met. So let's go back to Bob's foot. We might explain to Bob that if we can get him into housing, he maybe won't, his foot's not going to get infected, that he's going to be able to keep himself healthy and safe in housing. Um, yeah, so let's go to the next slide. So we're going to keep talking about, sorry, I have to move you around. I can't see my slide. We want to offer as many choices as possible and talk about opportunities. While it's really important for folks to know about the housing environment that they're in, which we know housing is really expensive. We know that no one's handing out vouchers. We do want to talk about the opportunities that do exist, and don't want to just focus on the barriers or the things that don't exist. We want to build confidence and trust as we accomplish things together. Samuel talked about this during our breakout. When our friend didn't want to leave shelter and go to housing, Samuel's like, I'm going to build him up. I'm going to tell him all the good stuff about housing, and I'm going to motivate him, and I'm going to see how I can best motivate him. So Samuel said it the best. We're going to provide relief and comfort back to the infected foot. people really can't think about housing if they're in pain. And if you think about it, if you have a terrible headache or you're not feeling great, can you get work done? I know I can't. I know I have to address whatever's going on in my life before I can be productive. So I think we have to think about that too. I think also providing relief and comfort lets participants know, like Matt was talking about, that they're being seen, that we see them, that we're not just bureaucrats with a housing application that we really just want to fill out, and we're not just bureaucrats, but that we see them as human beings. We're going to ask for help. So Matt said this before, and we're going to keep saying this. You have really, really hard jobs. You cannot do everything under the sun, but what you can do is have a pocket full of resources and really good people who you can call on. So you want to make sure that you have really good clinical consultation so that those folks can help you navigate when you have a problem, and you provide that really critical service to your participant. You're going to seek information. So when we're talking about collecting information for intake and assessment, your client's going to give you a lot of information, but you're also going to look at coordinated entry, HMIS, emergency medical services, hospital, healthcare, police, mainstream resources, and other service providers. Of course, when a release of information is needed, you're going to do that. But as we're building the intake and assessment and trying to learn so much about participants, it can be really helpful to not have to keep asking them the same question over and over again. So, and we're not going to go into detail now. Matt will talk a little bit more about it. When you're completing an assessment, you know a lot of information just by going into HMIS, by talking to other providers that you might be able to start collecting without talking to the participant about it, and sort of saving some time and preserving the relationship by being really respectful and not having to ask the same questions over and over again. So you're going to keep your promises. We talked about this on the previous slide, that you want to do what you say you're going to do. Again, folks have been really failed before. The system has really not kept all of their promises, and this is why they're not in a great situation in a lot of ways, that people have failed them. So it's very, very important for the relationship to do what they say you're going to do. Think about your own relationships in your life. If you have someone who always is failing you and just doesn't follow through, you probably don't want to continue a relationship with them, or you might have to, but you're not very happy about it. And then we're always going to pay attention to disabilities, race, gender, and ethnicity, and how that may impact our engagement. We might have folks who English is not their first language, or we might have folks who have literacy issues. There are all kinds of things, and we just really want to be sensitive to how we respond and react to people. Kind of slow it down and think, how is the best way to engage this person, and how can I build the best relationship with them?
Hey,
Okay.
Liz, it looks like Samuel has his hand up.
Hey, Samuel,
Please jump in.
jump in.
Yes, ma'am. Miss Liz, that's the main thing too. I was looking at the bottom of reading it, and that's very big too. Pay attention to all of them are obviously big points, but I noticed that as a CHW, paying attention to their disabilities, their race, their gender. That's very, very big, and it helps in building a relationship with them because, like you said, the main thing is being acknowledged, and a lot of them haven't been acknowledged. A lot of people, like you said, the system has failed in many kind of ways, and we can
Yep.
all guess what the system is in some kind of capacity. So, I feel like in my experience working with them, the aspect of race and gender and their disabilities are very, very big, and it's something that should never be overlooked as far as in who the person is, because that is how we really build a relationship, because we're acknowledging something that they're going through.
Right. Oh, thank you, Samuel. Well said. Well said. Anyone else? Does anybody else did we miss anything? Is there anything else that you think is critical to building a relationship with your participants? We didn't
Oh,
put
another
donuts
thing,
in here.
one more thing too, Miss Liz,
Please,
is
yeah,
that
yeah.
um and building relationships, especially trying to find a way to get them through their obstacle. We always should be able to talk to them and not at them.
Mhm.
That builds a healthy relationship, and it almost creates family, and let them know that we actually care because we're talking to them and understanding their situation so that they can get through it. So if we talk to them and not at them, no matter what the circumstance, it'll make an easier relationship too. Even if the person likes you or dislikes you, just talking to them and not at them helps calm the situation.
Oh, that's great, Samuel. That's perfect. You're exactly right. You're exactly right. Thank you for that. Anyone else? All right, we'll keep
And
going. Oh,
I would say, I'm sorry, I would say definitely listening to the client, really hearing them and where they're coming from is very, very important to understand what they've been through and better to help them in the future.
definitely. Thanks so much. We're going to talk a little bit about reflective listening later and then in more depth in other sessions. So that's it. Really, people being seen and heard. So thank you for that. All right, so how do I know if I was successful at day one engagement, right? It's like a date. They want to see me again. Yay. So that's great, right? So how do we keep the momentum going? We want to make every effort to engage new clients within 24 hours of a referral. So you don't want to be assigned to Bob, and Bob thinks, wow, I have a new case manager and he's excited to meet you. And then he doesn't get a call for 5 or 6 days. By then, you're old news to Bob, right? So you want to keep momentum going. After you had this great engagement with someone, you want to make sure that within 2 days you have reached out to them again. We're talking about following through on commitments, keeping promises. So it's really important that when you say you're going to do something, you do it. And again, we're always modeling good behavior for our folks. So when you leave your encounter with your folks, well, this is what you're doing, and this is what I'm doing, and when we're going to have it done. And then when you meet again, you want to have done what you said you were going to do. We're going to talk in more detail about warm handoffs in a couple slides, but we always say that a referral is not a warm handoff. So a warm handoff is when you have made, hopefully, like Matt said, a human connection. Matt, this is Bob, and talk about how all the strengths that Bob has. Let Matt know what he's going to be working on. But it's really important that folks are not just given a referral and away. They just really need a warm handoff and a really good connection. And again, we'll talk about that in a little bit more detail. Okay. So what does it mean to have a client-centered approach? So what we want to always offer services multiple times and in different ways. I remember talking to a case manager once, we were doing some technical assistance. They said, I don't know. Every day I call Bob every day at 2 o'clock and he just doesn't answer the phone. I don't know what to do. I'm engaging. I'm engaging. Well, if calling Bob every day at 2 o'clock and he doesn't answer the phone, that's not working. So what we want to do, and I think it was Samuel also talked about, we need creative solutions, right? So maybe Bob doesn't talk on the phone. Maybe Bob texts. Maybe Bob only wants to see me in person. Maybe Bob wants a cup of coffee. Maybe Bob doesn't like me at all, and I need to go to my supervisor and we need to figure out, oof, yeah. And my supervisor says, Liz, I don't blame Bob. He doesn't want to see you. Go see Matt. But let's see if Matt wants to, if Bob wants to meet Matt and mix it up. But we always want to use creative solutions. If folks aren't using shelter, we want to know that. We want to do a deep dive into understanding their perspective, asking questions. Matt's talked about safety. Maybe they don't feel safe. Maybe someone has an abuser in the shelter. Maybe they've used the shelter before and had a really negative experience. Maybe they're using and they aren't able to figure out how to use and stay in the shelter. So we always want to understand their perspective and see why they may or may not be using services. We want to help solve the problems that are most important to them. I'm going to keep talking about, Bob's infected foot. So if that's what Bob wants to work on, That's what we're going to work on. And that doesn't mean that we're not eventually going to fill out housing applications and get IDs and connect with DSS and get benefits and get employment and do all the other important work. But this is where we're going to start with where they are. We're going to advocate with community partners to make sure they're getting all the services that are working for them. So this is where we could talk a little bit about a warm handoff too, because you can have warm handoffs with lots of different kinds of community partners to make sure that your participants are getting what they need. Because again, and we'll keep saying this, there are lots of times they haven't gotten what they've needed, and they may need a partner with you to help and make sure that they can get those services and that they're really working for them. And then, of course, we're going to assist in getting temporary accommodations and permanent housing, then it can accommodate them, but also their family, whoever they choose to live with, and pets. So I don't know if any of you have pets, but I have a dog and I would never go anywhere without my dog. So I think recognizing, and especially for folks experiencing homelessness, how important that bond with an animal can be, and doing whatever you can to make sure that they're able to stay with their pet. So easy answer here in the last box is that engagement is everyone's responsibility. So we're never going to stop engaging. So initially it's our street outreach folks, coordinated entry, navigation, diversion, shelter, then ongoing is transitional housing, rapid rehousing, permanent supportive housing. But we're always wanting to have everyone engage because we don't want to just keep handing someone off. We're going to keep talking about warm engagements, warm handoffs, but we really want folks to feel like the system is as seamless as possible, which I know is really difficult, but we just want everyone to be engaged with that participant. And we talked about this in our group, that you want to go visit the participant who had been in emergency shelter once they're in housing. You want to keep those connections alive so that everyone is constantly engaging and taking care of these folks in our community. Okay. So we are doing an in-depth training on this. We'll do a real deep dive, but just to kind of do a teaser here, we're going to talk about housing-focused case management and best practices. So really what we're saying is that the client is the expert and we're going to help them, but the principle is that we want to use their strengths, we want to use their ideas, their goals, their dreams to make their housing happen and to use that as the principle in this journey towards housing. So we're going to use assertive engagement using motivational techniques. So we're going to be persistent and respectful. And we've talked a lot about engagement and motivating folks, but we're going to do anything we can to keep people engaged. We're going to do a comprehensive assessment and housing planning. Matt's going to talk a little bit more about this. And this is really important. We want to know as much as we can about what brought folks to their current situation, what strengths they have to get them out of this situation. We want to do housing planning with them that lets them really think about what they want, how their needs are going to be met, and certainly in a realistic way. They're going to be participant-driven goals, so they are going to set the goals. Matt's going to talk a little bit more about the goal setting, so I won't do too much here. Not quite done. Whoop, sorry. We're going to be recovery-oriented in the work that we do. I'm sorry, I've lost my... So we want to help. We want to focus on helping people build meaningful, hopeful, and independent lives. We want to make sure, and we've said this a few times, that folks have links to community supports. And we've said this a few times, but it's important to say again, you can't do everything, but you can connect folks to a lot of important things. So they have to have income and benefits. They have to have connections to health and behavioral health services. We want to make sure they have social connections. We want to make sure they know where there are mosques, synagogues, churches, so that they can enjoy a faith community if that's what they want to do. All the community things that we enjoy, libraries, sports, arts, recreation, because we want them to have an independent life. We want them to have a life beyond Case management, we say that's our joke. And everything that we're going to work on is going to be individualized, goal-based, and person-centered. So it's really listening to our participants, hearing what they want, and working on those goals. Okay. So, you guys here. So helping folks to build hope is critical to motivating them so that we can move towards housing, so we can move towards services and getting what folks really want. So if you think about your New Year's resolution, so I don't know about you, it's May, so I've given up on mine. But if we think about our resolution was to exercise every day and to go to the gym every day. Well, I gave up on that mid-January, and now I'm on my couch and I'm eating potato chips.
Yeah.
So, but maybe going to the gym in and of itself isn't meaningful to me. Why should I care about that? I don't know if you guys go to the gym, but I just doesn't smell very good, and I think everybody's skinnier than me, and I
Yeah.
just don't like it. So what is important to me is that I want to be able to exercise and chase my dog around without losing my lung and passing out. So maybe now I need to think about how I can get to that goal. And maybe it's not going to the gym every day, and maybe it's taking my dog on 2 or 3 walks a week. And I can do that, and that's meaningful to me, and then I can still reach my goal. So we always want, Matt talked about this, we always want to be nimble and flexible as we think about goal setting and really getting to what someone really wants. So maybe think about that, because if you don't think that change is possible, then you're not going to have hope, and you can't find meaning in something that isn't important to you. So you need to find something that's important to you. And now I'm going to just keep quoting Samuel, who talks about the confidence, right? How can you change if you
Miss
don't think
Liz,
you can do it, right? And Samuel says you
Miss Liz,
can do it, right? So we want to build that confidence. We want to find meaning. We want to always give people hope, and we want to be nimble as we do it and know that we may need to change things up. Oh,
Miss Liz,
Samuel, what do you have to
Miss
say?
Liz, I had wanted to add that in the process of making those goals too for them, we got to make sure that they're realistic, worthwhile, attainable, measurable, and timely.
Yes.
If we can make sure that they're working in that base and getting them where they need to be, then believe me, they'll definitely find a way to get over the hump, and they can use that in their every single day life, because it's 3 forms of motivation. The 3 forms of motivation that we deal with almost every day is fear, incentive, and attitude change. The fear comes because it's the unknown. It's like, I don't want to stick my hand in there because I'm scared. The incentive of doing it is now we understand what it feels like. Now we understand what the touch is. Now we understand what the scare is. The attitude changes once we experienced it. And now we can move forward. We have a different attitude, a different outlook, a different perspective on what we're going to do with this person, how we're going to do it with this person. So that those are the things that we work with in our everyday lives, as far as in working with the clients that we work with: fear, incentive, and attitude change. If we can get them built in that, and that those are 3 forms of motivation. So if we can get them built in that, then we can get them almost over that hump.
Very good. Thank you, Samuel. Anyone else? Oh, let's see. Questions, comments? Okay.
Feel free to unmute and jump in.
I'm sorry, I'm the only one talking so much.
That's all right. We love it. We love hearing you. All right. Let's keep moving then. Okay. We are going to do a breakout. And we would love for you guys to share strategies that you've used to build confidence. Well, it's all roads are leading back to client confidence. Made progress with a person who has given up on hope and said they have no goals, and how you've built motivation for housing with folks. So we are going to break people into groups and give you a couple minutes to chat about that. Thanks. I think Sarah set us up.
Great. Thanks. People are filtering back. Lots of good strategies to build confidence that came up in our session, our breakout, involving the client, which Liz has kind of outlined, but it really is reinforced by your experience as well that came up in the involving the client in the process, keeping them updated on next steps, being very clear about when you're going to see them again, and then follow through and having that consistency build a sense of confidence that the client is capable of making progress towards their housing plan. So all of those were great strategies. I don't know, anything to add from your group, Liz, before we plow forward?
Sorry, I was somehow not. Folks talked about sharing their experiences.
Oh,
They
yeah.
talked about, yes, they talked about active listening. I mean, Samuel all but sang some great songs to us. You're knocked down, but you're not knocked out. I mean, just some good stuff, right? Fight. We have a little music, right? We have Rihanna, work, work, work. A lot of good messaging, a lot of good messaging, really fantastic energy too. And just, it was clear from our room, just folks believe it can happen. There
Mhm.
is a lot of hope, right? And then a lot of confidence is about just like Samuel said, like it's gonna happen. We're gonna make it happen. Like I believe him.
Yeah.
I follow Samuel anywhere. So I think having that great energy. Matt, I don't know if we have everyone with us though. Do we?
Do we?
I'm not seeing everyone. So I don't.
It might be a view setting because I think
You
the
see them?
breakout rooms have closed, right? So they have to join. Is that right, Rosa?
Yeah, the breakout rooms have closed.
Okay.
Okay.
So
Yeah,
I'm
and the
hopefully
seeing
they'll.
people slowly come.
I see. It just takes, you have to like select the button to advance to come back to the room. Yeah. So we're going to jump in, and I know we just have a couple of minutes left, so I'm going to pick up the pace just a tiny bit.
Yep.
But just know the slides, the curriculum, the content will be made available to everyone. So even though I'm going to move a little bit faster, you'll have access to this information after the training. I love this slide. Intake as an event, needs assessment is a process. To
Yeah.
separate those two, to kind of
Yeah.
think about them a little bit separately, we often, I know I did, would just fold them together, bust out an intake, do the needs assessment all in one setting. You want to get as much done as you can. But the point of doing a needs assessment is not just asking questions and filling out the form. It's deciding together with your client what you're going to work on and what that schedule looks like. And that takes time. So a needs assessment is not something you do just every 6 months to update the form and then you kind of refresh it in whatever your HMIS. It's something that you should do consistently every time you talk to your client. You don't ever have to say to your client, well, I have to fill out this form because everyone, this is a requirement and I have to submit this and everyone has to do this. Everyone hates forms and it feels bureaucratic. It doesn't feel human. It doesn't feel, so many of the questions on a form might not contribute to what the client is really interested in. So a best practice is to just kind of put down the form. Maybe you're going to take notes or jot down some ideas, but then complete the needs assessment later. Focus on what they want, what their strengths are, and then and when you're ready to complete the form, you maybe do that back at the office. You don't have to do that in the setting with them. The most important thing is to just build trust with your clients so that they believe there's a process and a purpose to sharing information with you. The more they tell you, the better able that you're going to be able to help them and that you can give them accurate information about what's available to them and how that's going to lead them to getting housing. So we want to make sure that we're focused on needs assessment as a process, not just as a one and done. Let's talk about accessing a temporary place to stay. This is maybe one of the first kind of fundamental elements of intake and assessment is to identify a temporary place. It's clearly safer for folks to be inside rather than outside, and it will make it easier for them to work towards a housing plan if they have a safe, sometimes it's temporary shelter, but they have to have a safe place to stay. So be sure that they understand how their various shelter or temporary shelter options might impact eligibility for permanent housing down the road. Sometimes, depending on the program that you're aiming for, that you're trying to get them eligible for, enrollment in transitional housing might have impact in a way what they're eligible for down the road. So talk to your supervisor or your program manager if you're not sure about what happens if you're making a referral to transitional housing. For some of you, the focus of your assessment work is to identify and explore simply safe, temporary living arrangements. Others of you might focus on the assessment of building a pathway to successful housing outcomes, and those are intended to be more long term. So the techniques for intake and assessment are going to be relatively the same. And let's now, in the next slide, explore what those techniques are. Each of these domains and the answers to the questions within these domains are going to help you fill out a required form and complete required data elements. And that's great. We all need to do that. We know that those are really critical. But remember, the primary focus during assessment is to use that process to develop a relationship, to develop trust, to build the client sense of agency, to address immediate concerns, but to start to build a housing plan. So the most common domains include the ones listed on the slide: housing and the history of homelessness, if there is one, income and education, life skills, supports either through family, friends, or other social systems, behavioral health issues, and these tend to be mental illness, substance use disorders, and then also physical and medical issues. So we want to use our assessment process to drill down on each of these domains. We're not asking these questions simply for the sake of asking them. Ultimately, what we want to understand, and we need to understand as completely as possible, what's going on with the client. And then we're tying their history, their needs, their interests to a housing strategy. The housing strategy may be our goal, that's our focus of our work, but as we've talked about, it might not be what the client leads with. They might not express, I want housing. They want their foot, if they have an infection on their foot, that's what's driving them. So our goal is to tie addressing the foot infection or the pain to some kind of long-term housing plan. Our job is to make that connection. Now, I recognize that some of you have required forms that your agency uses. Maybe you have an acquired assessment tool that a funder of your project requires. We at Housing Innovations have some examples of intake and assessment tools. We'll share those at our in-person training, and we'll also practice at that in-person training, completing those in a way that is building a sense of agency and engagement with the client. Now let's talk about goal setting and service planning.
I'd love to raise a comment from the chat before we
Sure.
transition. So Derek shared, regarding confidence, often his challenge is in coming up with a viable housing plan to build confidence around. Many clients are on long waiting lists for housing subsidies and they don't make enough to afford most market rents. Some are on fixed
Mhm.
income. As a parent with a single income, people are struggling to find a landlord that will accept their voucher while meeting their other housing goals.
I love this question. It's absolutely the right question. And I know that most people struggle with this. We wish that we had sufficient rapid rehousing and PSH and housing subsidies to get everyone would benefit from them. Everyone would certainly, benefit from that. But they just don't exist at the scale at which we need them in the system. In subsequent trainings, we're going to talk much more about building a housing plan that recognizes the resources available in the system. If someone has really significant barriers, past evictions, no employment history, they're going to have a really tough time finding a landlord that will rent to them. So we might need to explore other options. And what those other options are and how we kind of build that into our assessment process to kind of flesh out what's a feasible, likely housing option in the near term may include CFC resources, but it may also include other kinds of housing options. And we'll talk more about those. Shared housing, returning to friends and family, reunification, worker dorms or short-term rentals. All of these other issues have to be on the table, and some people are not actually likely to sign a lease because of their history or legal issues or other barriers. So if that's the case, we need to explore those. So let's talk about goal setting and service planning, how that might relate to some of finding a housing plan. The service plan is an agreement, and it's an agreement on what we are going to work on together, the case manager and the client. It's your commitment to your client about how you're going to help them and what specifically each of you are going to do and by when you're going to complete it. But remember, part of a trauma-informed care process is that we need to be predictable, we need to be clear, and it's crucial that you follow through. So if you have an element of their plan that is a sort of a contingency, you need to bring eligibility information so that they know whether or not they're going to even be able to apply for a rapid rehousing slot. We need to follow through on that and be consistent with that. So you might want to ask them, what is it about housing that is going to help you? So what is, what's the so that principle? Andrea White talks about this on our team. It's what's the motivation underlying wanting a place to live? So if they understand, if we come to them and say, our goal is to get you housing, they have to have some kind of connection to why that's important to them. So if you ask, why would that be? So what? So that what's going to happen when you get housing? It might be that they want to reunify with they have a dog that someone else is keeping for them because they couldn't manage it while they were in a shelter. Maybe they want to have a relationship with someone and they can't do that in a shelter. And so having their own place is where they might be able to reconnect with a boyfriend or a girlfriend. Maybe they want their kids to visit. They haven't seen their kids or they've lost custody. So that might be a goal. Maybe they just want to have their mom be proud of them. That's a clear indication that they've made some progress. The reason is going to be different for every person, and the plan needs to break down all of these the steps in a kind of a clear and logical way. I know that we're like exceeded our scheduled time. Is that right, Sarah and Rosa? And I'm just gonna hope that you have a couple of extra minutes to hang with us, and I'm gonna try and move through as quickly as possible to make sure that we get to all of the content. But I do recognize that you have commitments that you've made and schedules, so I'm hoping that you can stay with us. We'll make sure to get through the rest of these slides in just a short period of time. Partnerships and linkages. As we've said before, no expectation that you're going to do this alone and that the client is going to do it alone. So here are all the resources within each of these different domains or these realms that you want to explore to help support the housing plan. Look at, you're going to have to figure out whether or not landlord, emergency assistance, are they going to look for a job? Are they looking for benefits? Mental health and substance use, social connections, life skills, if they want to really develop some interest around a particular, like affinity group, that's going to help them. And so we want to explore those partnerships and linkages and make sure that that they're connected to their long-term housing plan. Let's talk a little bit more about partnerships and successful linkages and how this translates on a day-to-day basis. Your case management activity is to understand a little bit more about what's available in the community. So what that looks like is you don't have to know everything, but you have to know where to go to understand what are the resources in the community. Ask the people in those resources or accessing those resources what's available and general information about eligibility so that you can be knowledgeable and start to make those connections. You're going to introduce yourself and your service, that you'll discuss the nature of the partnership, a case manager and a client, and what your role is to help bring information and resources and then help connect that to a housing plan. And you're going to accompany them or assist them whenever it makes sense, whether that's in case management meetings or maybe it's actually even looking for housing or doing home visits. So that's what those partnerships and linkages might look like. In terms of navigation, you're going to help clients to understand what their permanent housing options are. What are they eligible for? You're going to talk to them about what kind of housing they want to live in, where is it, and with whom. Make sure you understand what things are non-negotiable for them. They might not want to live on the east side of town. They had a, bad relationship there. There's a safety issue. That is a non-negotiable. So that's good to know. Maybe they can't navigate steps, so they have to be on a first floor unit. That's a non-negotiable. So that's helpful to understand as you're navigating the housing options and understanding what options they're going to pursue. It can be helpful to talk about how their first place that they land is just a stepping stone. You're not looking for their long-term, forever house. It can be a 12-month kind of transition place that's on the pathway to some long-term different housing arrangement. So they don't have to think of their housing as their forever place. And then I also want to talk a little bit about the transition to housing, especially in the context of trauma. Just the process of identifying, finding, and then managing that transition can create a lot of uncertainty, and it brings up lots of issues for people. We tend to think of housing as safe, as stabilizing, it's a great environment, but it actually can trigger for someone who's experienced long periods of instability or unsheltered homelessness, can trigger feelings of inadequacy or fear. So we just need to know that or be aware that that change can be jarring and scary, and it brings up all kinds of feelings of failure and isolation, disconnection for people. But people often have a lot of hope during transitions too. So that might be the case. And we want to build on that, recognize that it can be different. And there's sort of, how people manage these transitions is going to look a little bit different. And we need to be prepared to address those differences. All right.
Yeah. So, like Matt said, it's not an easy process. It's stressful, and folks may have had some trauma. So it's really important that you're going to provide critical support during the housing application and move-in process. And you're going to want to educate yourself if you don't already know who's eligible for what, when are their meetings, and how can you help? And if you don't know about the matching process or the by name list or how this all works, just make sure you connect up with a supervisor so that you can be the best advocate you can, because you want to participate in case conferencing. You want to go to matching meetings and really advocate for your participant to make sure that they get the best situation for them. We want to make sure that our clients are going to be successful once they get to housing. And it's not easy stuff. We want to make sure they know about their rights and their responsibilities. We want to mitigate risk. We want to make sure that folks are going to be able to stay there. So we're going to want to make plans with tenants to say, hey, how can we make this right? How can you be in the best place possible? We want to structure their initial days. So we've been talking about this. It's a tough transition. People feel lonely. People miss their communities. And so we want to give them some structure and purpose for their first few days in housing at least. We're going to make sure that we keep following up and engaging with them. You might keep your enrollment open so that you can continue to visit them. We keep talking about warm handoffs. We want to make sure that you are there to introduce them to the new case manager and maybe work with the new case manager to see who's going to do which tasks and work together on that. Okay. Um, Again, the work is not easy. You're going to make sure that you share your challenges, your updates, successes with your teammates, with your supervisors, so that you can get help as needed. We're going to prepare and support the clients for anything that might be happening that threatens their housing stability. So we're going to let them know about home visits and what that looks like. We're going to make sure that they have a crisis plan and talk to them about what they're going to do if they get in any kind of trouble. We always want them to have their lease on hand and to sit and look at the lease with them. I always tell providers who can't find the lease that it's really hard for tenants to follow something that they don't have, that they don't have that guide in front of them. Matt talked a lot about this. Community engagement and connections are huge because folks need to be able to be independent and self-sufficient. And the best way to do that is to be out in the community and get what they need. We're going to always make sure that folks have income supports and benefits connection, and we're going to work on exit planning with them. Keep talking about warm handoffs enough already, right, Liz? We really just do know how very, very important this is. So we always want to leverage the outreach workers' deep ties to folks as they transfer over. You guys know this, that often the first person who's really gotten through to you, who's really helped you, is such a special person in your life. And so we really want to leverage that person as they make connections with other folks that you're going to be working with. As I mentioned before, once you connect up with the housing case manager, you want to decide who's going to do what, divvy up tasks, and you want to continue to support that client. Even though they have a new case manager, we do want to make sure that you keep some kind of connection with them for at least 3 months. Okay. So these are just other resources to look at. Check out the links. So just to keep just to keep abreast of what's going on. And there are some great trauma-informed do's and don'ts. Matt talked about the importance of really understanding trauma, so check that out along with the others. And please reach out. You have fantastic folks here with Sarah and Rosa. You have an HMIS help desk connection there. And I would encourage you to do, we have it in Connecticut too, use their office hours because HMIS is not easy and intuitive. And it's always good to ask questions and find out all you need to know about HMIS. And here's contact information. And I think that is it.
I appreciate everyone hanging with
Yeah,
us. We
thank
went a
you
little
so
bit
much.
long. We'll try and be more focused and diligent to fit the training within the scheduled time. But thank you so much, everyone. And we look forward to joining you again in 2 weeks. We're going to be talking about housing-focused strategies. So stay tuned.
Very
Thanks,
good. Thank you
everyone.
so much. Take
Thank you.
care.
Thank you.
Be well.